we cordially invite you all for the 2 days training program on Best Practices and Enforcement of Drugs and Cosmetics Act 1940, Rules 1945 and DMR Act 1954, organized by Central Council for Research in Siddha, All India Institute of Ayurveda and State Licensing Authority of Directorate of Indian Medicine and Homeopathy. மத்திய சித்த மருத்துவ ஆராய்ச்சி குழுமம், அகில இந்திய ஆயுர்வேத நிறுவனம் மற்றும் மாநில உரிமை ஆணையம் இந்திய மருத்துவம் மற்றும் ஹோமியோபதி இயக்குநரகம் இணைந்து நடத்தும் இந்த 2 நாள் கருத்தரங்குக்கு தங்கள் அனைவரையும் வருக வருக என்று வரவேற்பதில் பெருமகிழ்ச்சி கொள்கிறோம். In the era of globalization, there are growing concerns regarding the clinical safety of Ayush drugs, and pharmacovigilance is an intact part of this drug regulation system ensuring the patient safety. So it's crucial to educate the relevant officers of ASU drugs about creating a reliable supply chain and understanding the related legal regulatory requirements through in-depth training program, which has been organized by CCRS, AAA and DIM. அன்னை தமிழின் ஆசியுடன் சித்தர்களின் வழிகாட்டலுடன் இந்த 2 நாள் கருத்தரங்கம் இனிதே துவக்கம். Now I request the dignitaries to kindly occupy the dais. May I now humbly invite Professor Dr. N.J. Muthukumar, Director General, Central Council for Research in Siddha, to kindly occupy the dais and also accompany the dignitaries. I invite Professor Dr. V. Bhanumadi, Chairman, Scientific Advisory Board of CCRS and former Director of National Institute of Siddha, to kindly grace the dais. Please, ma'am. I invite Dr. P. Parthiban, Joint Director, Directorate of Indian Medicine and Homeopathy, to kindly occupy the dais. Please, sir. I request Dr. S. Selvarajan, Research Officer, Scientist 4 of CCRS Headquarters, to be on the dais, please, sir. I invite Dr. Y.R. Menaksha, State Licensing Authority for Indian Medicine, Directorate of Indian Medicine and Homeopathy, to please occupy the dais. I also invite Dr. A. Rajendra Kumar, Research Officer, Scientist 3 of Central Council for Research in Siddha, to kindly be on the dais. Thank you, sir. Thank you, madam.
Good morning to everybody. Respected Professor Dr. N.J. Muthukumar, sir, Director General, Central Council for Research in Siddha. Professor Dr. V. Bhanumadi, madam, Chairman, Scientific Advisory Board, Central Council for Research in Siddha. Professor Dr. P. Parthiban, sir, Joint Director, Director of Indian Medicine and Homeopathy. Dr. O.R. Menaksha, State Licensing Authority for Indian Medicine, Director of Indian Medicine and Homeopathy, Chennai. Dr. A. Rajendra Kumar, sir, Research Officer Siddha, Scientist 3, Central Council for Research in Siddha. Esteemed dignitaries, respectfully, I am welcoming all of you for this milestone event, which is conducted jointly by CCRS, All India Institute of Ayurveda and that of Indian Medicine and Homeopathy. A very warm welcome to all of you for this 2-day training program on best practices and enforcement of the Drugs and Cosmetic Act 1940, Rules 1945 and the Drugs and Magic Remedies DMR Act 1954. It is indeed a privilege to gather here with all of you today. The presence of such distinguished experts and officials from across the country signifies the importance of this training, and I express my heartfelt gratitude to all the dignitaries for joining us today. As we are all aware, the Drugs and Cosmetic Act 1940 and its accompanying rules are the cornerstone of regulating the manufacturing, distribution and sale of drugs and cosmetics in India. The Drug and Magic Remedies Act 1954 further plays a crucial role in ensuring the harmful or misleading remedies are not marketed. This training aims to provide a comprehensive understanding of this legal framework and their enforcement, focusing on the best practices that must be followed for ensuring public health and safety. Our collective efforts are essential in strengthening the regulatory systems, improving compliance, and effectively enforcing these laws. At this outset, I wish to extend a very warm welcome to our chief guest in his absentia, Dr. Kaustuba Upadhyaya Sir, Advisor Ayurveda Drug Policy Section, Ministry of Ayush, Government of India, New Delhi. Sir will be joining through online around 11:30 a.m. today. And our hearty welcome to Professor Dr. V. Bhanumati Madam, Chairman, Scientific Advisory Board. Madam is extending all the supports for the development of Siddhastama medicine. And we extend a very warm welcome to Commissioner Madam. Madam is busy. Due to her busy schedule, she could not take part in this event. Trimadi M. Vijayalakshmi, Commissioner, Director of Indian Medicine and Homeopathy, Chennai. We welcome Dr. P. Parthiban Sir, Professor, Joint Director, Director of Indian Medicine and Homeopathy, Chennai, who is gracing the occasion. I also welcome Professor Dr. Galib. He is in airport. He will be joining with us within 20 to 30 minutes. Additional Professor and Coordinator, National Pharmacovigilance Center, All Institute of Ayurveda, and Dr. O.R. Manaksa, State Licensing Authority for Indian Medicine, Director of Indian Medicine and Homeopathy, Chennai, who are the co-organizers. Dr. A. Rajendra Kumar, Sir is supporting for conducting all the events in CCRS, and for this event also he has taken a lot of efforts. It is my pleasure to welcome Professor Dr. N.J. Muthukumar Sir once again. Without him, we cannot think about this event. Sir was in Malaysia for the last 1 week, and from there he has directed us how to conduct the event. Due to his support and energy and capability, we are here and we are conducting this event. Though the training, we aspire to equip all the stakeholders with the necessary tools and knowledge to ensure that drugs, including those under traditional systems like Siddha, are manufactured, distributed, and used in a manner that adheres to the highest standards of safety, quality, and efficacy. This initiative, supported by the Ministry of Ayush, Government of India, is designed not only to foster a greater understanding of these regulations, but also to encourage collaboration and knowledge sharing among various institutions and practitioners. I would like to take this opportunity to welcome all the resource persons, speakers, and trainers for their valuable contributions to this program. Their expertise and insights will go a long way in enriching our understanding of the subject matter. I invite all the participants to actively engage in the discussions, share their experience, and absorb as much as possible, and utilize the knowledge after taking part in this event, and disseminate the activities in your field, as this will undoubtedly help us work towards a more robust and compliant regulatory system. Once again, a warm welcome to each one of you. I hope that over the next 2 days, we can build valuable skills and foster productive collaborations that will help us uphold the highest standards in the enforcement of Drugs and Cosmetics Act 1940 and the DMR Act 1954. Thank you, and I wish you all a successful and enriching training experience. Thank you very much. Have a good day to you all.
Thank you for your welcome address, sir. We request all the dignitaries in the dais to light in குத்துவிளக்கு. குத்துவிளக்கு ஏற்ற மேடையில் இருக்கும் அனைத்து சிறப்பு விருந்தினர்களையும் அன்புடன் அழைக்கிறோம்.
Thank you, sir. May now humbly request our State Licensing Authority to honor our Director General. Please, sir. தலைமை இயக்குனர் பேராசிரியர் மருத்துவர் N.J. முத்துக்குமார் நிறைவு பரிசு வழங்கி சிறப்பு கௌரவிக்கப்படுகிறார். மருத்துவர் பார்த்திபன் இணை இயக்குனர் இந்திய மருத்துவம் ஹோமியோபதி இயக்குனரகம் கௌரவிக்கப்படுகிறார். பேராசிரியர் மருத்துவர் வி பானுமதி மேடம் அவர்கள் CCRS இன் தலைமை இயக்குனர் பேராசிரியர் NJ முத்துக்குமார் அவர்கள் கௌரவிக்கப்படுகிறார். Dr. Y.R. Manaksha is honoring Dr. S. Selvarajan. Thank you, sir. A. Rajendra Kumar, Research Officer, Scientist 3, CCRS is being honored by Dr. Y.R. Manaksha. Thank
Respected Professor Dr. Banamadi, Chairman, Scientific Advisory Board of CCRS, moreover former Director, NIS. Respected Dr. Parthiban, Joint Director, Directorate of Indian Medicine and Homeopathy. Respected Dr. Galib, Additional Professor and Coordinator, National Pharmacovigilance Center, All India Institute of Ayurveda. And my dear delegates, friends, the key speakers of the 2 days seminar. Happy morning, one and all. It is both an honor and privilege to address you today during the significance of 2 days training program. As we come together to explore the challenges and opportunities associated with Siddha medicine, we must acknowledge the profound heritage of this ancient healing system. The system with its comprehensive pharmacopoeia, academic knowledge and reliance on natural herbs and minerals holds a wealth of potential for enhancing human health. However, as we came to move toward its wider acceptance and integration into global healthcare landscape, it is crucial to address several contemporary challenges of our Siddha system of medicine. At this juncture, I must thank our Honorable respected Secretary, Vaidya Rajesh Kotecha, has given his consent and support for conducting this 2 days essential seminar to proceed with this training program. Moreover, we have to thank Dr. Kaustuba Upadhyaya, is a Ministry of Ayush Drug and Policy Section Advisor. He is also joining with us in the online meeting. So, on behalf of CCRS, All India Institute of Ayurveda and Director of Indian Medicine, we must thank Dr. Upadhyaya also. One of the foremost challenges lies in the commercialization of Siddha medicine. The natural substances utilized in the system often have a limited shelf life. When these products are commercialized, they must transformed to meet the expectations of the modern market, which often includes consideration of portability and durability. To extend the shelf life of these products, preservatives are frequently added, which may inadvertently compromise their medicinal efficacy. This dilemma underscores the importance of ensuring that Siddha and other Ayush medicines maintain their therapeutic properties without compromising their integrity during storage and transportation. Equally, processing is the big issue of safety. As with all medicine, we must ensure the safety and efficacy of Siddha products, particularly in the context of their growing presence in global market. To this end, robust pharmacovigilance program are essential. These programs serve as a safeguard, monitoring the adverse effect of Siddha system of medicine and ensuring that they may remain safe for use by patients. The need for comprehensive training in this field cannot be overstated. Officers involved in drug regulation, Siddha professionals, academicians, representatives from pharma industry must receive specialized training in pharmacovigilance to keep pace with the emerging challenges and protect the public health. This training program has been designed to address critical issues surrounding the enforcement of the Drugs and Cosmetic Act 1940 and Drugs and Magic Remedies Act 1954 and the regulations governing ASU drugs. A central theme of the program will be regulatory compliance and the standards required for the licensing and the quality assurance of ASU drugs. The roles and responsibilities of the drug inspectors of India and especially Tamil Nadu in enforcing these regulations will also be discussed in detail in these 2 days training program, ensuring that we strengthen our mechanism that ensure the safety and quality of Siddha products available in the market. As the global demand for herbal medicines continues to rise, it is imperative that Siddha drugs meet the highest standards of good manufacturing practices, GMP. This includes ongoing education programs that focus on adverse drug reactions, drug-food interactions, and the necessary mechanisms for reporting safety concern. Such programs are critical not only for protecting consumers but also facilitating the global acceptance and integration of Siddha system with the mainstream healthcare. The training will also cover the essential aspects of labeling, certification process for ASU drugs, ensuring that manufacturers adhere to established standards. The proper procedures for licensing and registering Ayush healthcare organizations will be explored in this program, along with the protocols for reporting ADRs and dealing with misleading advertisements. By providing participants with a comprehensive understanding of regulatory enforcements in India, we aim to equip them to play a significant role in the safe development and global dissemination of Siddha product. This training program is more than a mere informative session. It is an opportunity to engage in meaningful discussions that will shape the future Siddha medicine. Though interactive sessions, we will work together to enhance our understanding of regulatory landscapes, strengthen pharmacovigilance system, and ensure that Siddha medicine are safe, efficacious, of the highest quality. I look forward to the productive discussions and collaborations unfolding during these 2 days. Together we can advance the global growth of Siddha medicine and ensure its place as a trusted and revered system of health care. I must congratulate the CCRS team who worked for the past 2 months to arranging these 2 days sessions and all the logistic arrangements, travels and communications, all other. And All India Institute of Ayurveda, they have financially supported, and Marley they are also supporting in pharmacovigilance section, and our state licensing authority of Directorate of Indian Medicine. Actually, we both only initiated with a small discussion, we started this program 3 months back. Now it came as a very big program of this day with the 2 days training program. So once again, on behalf of Central Council for Research in Sintha, I welcome all the delegates and my working team and the All India Institute of Ayurveda and Directorate of Indian Medicine, especially SLA. And I thank our Commissioner and our Joint Director for organizing this much delegations from the DSMO side and other state peoples. And I also thank all the principals who are all deputing their faculty members of Gunapadam and Nanjanol with their pharmacovigilance people and other delegates. I welcome you all. Once again, thank you.